All right. Well, thank you everyone for joining me on this Good Friday. My name is Dr. James Young, your host for Pick My Brain. So here to serve you with some top-notch mental health wisdom, all free of charge, so we can all reach our full potential. Okay, today, so we have an exciting topic today, which is, should I take an antidepressant? I think it's a question that so many people battle with. And so I thought that I would just kind of go head on and just try to answer this question for you all. And of course, I do not know your individual situation, nor am I your psychiatrist. And so I please hope that you would seek help if you need to see somebody. But this would be a great starting guide for you to start think about as opposed in relation to answering this question. So again, without further ado, so today's question is: should I take an antidepressant, also commonly known as the SSRIs? Now, we've got to get rid of the stigma of talking about mental health, or even, even in the public square, we don't really talk about mental health too often. And so I just thought that I would start with a joke about being on an antidepressant. So a patient came in and told their doctor, says, yoga is the best antidepressant available. And what did the doctor say? Sounds like that's a bit of a stretch. All right. Yeah, I know that was a little silly there, but I thought that was kind of funny. Maybe if you think that was funny, please go ahead and put in the comments so that I'm not the only one that thinks that was funny. But that joke actually highlights about how there's so many opinions out there about what is really the best way to treat depression. Now, amongst the options out there, of course, is today's topic, which is the antidepressants, or also called the SSRI. Now, I'm going to try to redeem myself and give you another joke. Okay. So, SSRI actually stands for, medically, selective serotonin reuptake inhibitor. But some may say it stands for still sad, really improving. What do you guys think about that one? I think that was, yeah, I think that was pretty good. I think that one deserves a round of applause. And so there you go. All right. All right. So let's get started. So should you take an antidepressant or an SSRI? Now, disclaimer, this is not a medical advice and this is for educational purposes only. But again, I believe that this will prove to be a helpful guide for everyone who's watching or considering to be on antidepressant. So here's my short answer: no and yes. It's a loaded question, guys, and there really isn't a straightforward answer to this. But here are the 5 questions that I believe will be helpful to answer this question. Okay? All right, so let's get on with it. So, question number one is: do I have a clinically diagnosable depression? That's the first question that we must answer. Do I have a clinically diagnosable depression? So, a clinical depression means having low mood, low energy, low motivation, unable to experience pleasure or joy, change in appetite, change in sleep pattern, sex drive, and even having suicidal thoughts for the most of the day for a prolonged period of time. Okay, to the point that it is causing difficulty in your life. If the answer is yes, then here's the next question that you must answer: how severe is my clinical depression? Is it mild? Or if it's mild, then which means still able to function without significant impairment, then you should definitely consider some other non medication options, which I will be sharing in question 5. Or is it moderate? Able to still function, but definitely experiencing the impairment from depression and not getting better though. And so then, maybe you should consider the medication as one of the top treatment options. Is it severe? Unable to function normally, unable to care for self or others, and even safety is at risk, meaning you're having suicidal thoughts, you're having some neglect of self, you can't really take care of yourself. And so in these cases, medication is usually required, at least so to temporarily reduce the symptoms until other options become viable. Okay. All right. So the second question was, how severe is my clinical depression? And then it was from mild, moderate to severe. Okay. Now the third question, if you believe that the medication is still necessary because maybe you're in the moderate to severe intensity of symptoms, then the third question that you must answer is, will the medication help me more than potentially hurt me? Will the medication help me more than potentially hurt me? So, one key thing that you must consider is the impairment that you are currently experiencing due to depression, and whether being on the medication would help alleviate that impairment enough that it is worth risking potentially having side effects. Look, guys, the reason why, one of the reasons why this question is so loaded and difficult to answer is because of the side effects, right? The side effects can be, for some people, completely non-existent to pretty severe, to the point that they just can't be on the medication anymore. And as an experienced psychiatrist for the past 8 years, I've seen it all, right? I've seen people, again, without any side effects at all, to the point where it's really harmful for their body, and you really don't know how you're going to respond to the medication until you actually start it. And everyone responds in a very different ways. And so that's a difficult question that you must answer. Okay. And another sort of a side effect that you might actually have from being on an antidepressant is actually when you stop it. Okay. So when you actually stop taking the antidepressant, you're going to have what is called a withdrawal symptoms. Okay. So the withdrawal symptoms can last sometimes anywhere from a few weeks and sometimes to even months. And this is when you're going to feel like you're going to have as if like you have a flu. And you have low energy, your moods are going to be everywhere, and you're just not going to feel well. Okay. So that might last anywhere from a few days for some people, or none at all if done right with a provider that is actually experienced in doing this, or sometimes it could last 2 weeks or months. And so that's a question that you must answer. Will the medication help me more than hurt me? And again, like I said, sometimes you don't really get to find that out until you actually try. So, which adds the complexity of this question of whether you should be on an antidepressant or not. Now, the next question is, am I okay? Are you okay with the fact that you are going to be on an antidepressant? Are you okay with the fact that you're going to be on Prozac and Zoloft and Lexapro, right? Those are all the common medications that we prescribe. And the reason why I ask this question is because, even though like this question seems redundant, is because it's not uncommon that people experience feelings like they're weak, powerless, or they lack strong willpower, or simply they get this feeling that they're now dependent on medication. And most people don't like that feeling, right? So being on an antidepressant may threaten your sense of agency, which is feeling like you're in control and you can overcome anything that comes your way, right? You kind of determine your path forward on your own. And some people may even feel guilty and feeling like they're betraying themselves, or maybe they're not, putting their faith in God to overcome this depression that they have. So, if that's something that you might experience, then you definitely want to consider other options that are there besides getting on an antidepressant, which I think for me is one of the most exciting things about the field of psychiatry is that, I think as a field, I think we have far too long did not give a fair attention to other non-medication options. But I think most recently, people are really advocating for non-medical options, which again I will talk about in the next question. And those are truly a viable and great effective options that I believe you should consider. Okay. So the next and the final question is, what are my options? Okay. So let's talk about the options. Let's talk about, options besides the medication. Number one, psychotherapy or counseling. So for mild to moderate depression, as we talked about earlier, a type of therapy called cognitive behavioral therapy, usually it does the trick, right? You don't necessarily have to be on a medication if your depression severity is mild, maybe even to moderate. Okay. And so, and cognitive behavioral therapy is just one type of an effective therapy. And there are so many other types of therapies that can be very helpful in helping with the depressive symptoms. Number two, there's lifestyle modifications, right? So there's diet. So diet has been most recently been highlighted as potential cause and as a potential treatment for depression. So it's something that you really want to pay attention in terms of like what you're eating, how you're eating, and also how it can be a potential treatment for your depression. So diet is one. So regular exercise. So studies have shown over and over again that physical regular exercise can be as good, as effective, or if not even more effective than antidepressants in terms of helping people overcome depressive symptoms. Regular and adequate sleep is obviously a very important factor in terms of helping with depression. Work-life balance. I covered this last week in our Pick My Brain webinar, where I showed the balance between the protective factors and then the risk factors. And the work-life balance can be one of the protective factors if you do it well, right? If you do it in a way that helps you. But work-life balance, more often than not, is actually a risk factor for most people because most people don't get enough rest. Most people are overworked, and so that can become something that can worsen your depression, but also something that can actually alleviate your depressive symptoms. Religious beliefs and spirituality. Today is Good Friday. Many people are religious and many people have spiritual practices. And many studies show how the effectiveness over and over again of the religious beliefs and the spiritual practices on mental health in general, but especially for depression. Okay. So when you have religious beliefs, when you have regular spiritual practices, whether it's as prayer, meditation, reading scripture, or even attending services, going to church, going to a temple, or going to a mass. So all those things can actually help your depressive symptoms, right? So it's there's a lot of behavioral activation when you are participating into these faith practices. So that's definitely something to consider. Now, number four, natural supplements. Okay, so recently we've had some explosive research and interest in natural supplements as the potential treatment for a lot of the mental illnesses, including depression. Okay, and so there are several that I use actually in my own clinical practice, which I love to share with you. And just if you want some of those things, I don't have the time to cover here in this Pick My Brain, but in the future, I hope to do a webinar on this very topic of the natural supplements that you could just take. You don't even need a doctor's prescription to take. So if you like to receive that, please go ahead and either DM me your email address or put your email address in the comment section so that I can send you a teaser of the natural supplements that I'll be talking about in the future. Okay. All right. And last but not least, doing nothing is actually an option. Okay. Studies show that about 20 to 30% of people actually get better by just doing nothing. All right. And that kind of sounds crazy, but sometimes just the watchful waiting, we call it in that's a fancy medical term of like doing nothing. So when you do the watchful waiting, sometimes you actually get better over time, right? Or even time, right? We say that time is the medicine. So sometimes time itself can actually heal the depressive symptoms. But obviously, that's really the minority subset of patients, and so I wouldn't necessarily recommend that, because that's just because there's so many other things that you can actually do to help yourself. And um and therefore, yeah, like I wouldn't advocate for that, but I just want you to know that that is an option. Okay, and that's a very interesting option as well. Okay, so we just went through the kind of, zip through those 5 questions, and again, I hope this is helpful for you guys, to kind of think about these questions whenever, whether it's yourself or somebody else, your loved ones, that are trying to ask this question of, should I be on an antidepressant? This is a lot of information I try to pack in within 15 minutes, and obviously I did not succeed in doing that. I went a few minutes over. But again, if you like this material, like, to be emailed to your inbox, please go ahead and put your email in the comment, or just DM me your email address, and I'll get these things to you. Okay. Now, so we started with a joke, an antidepressant joke, when we first started this webinar. So I'm going to end it with another joke. All right. So there was a man who accidentally took laxatives instead of his antidepressants. How did he feel afterwards? He felt empty inside. All right, I really thought it was very funny. I don't know about you guys, but yeah. So there you go. There's another joke right there for you. Okay, so I don't know if there's any questions, but if there's any questions, I'll go into a time of Q&A, and so this is really the time for you to now kind of pick up my brain, um, and so, yeah, please go ahead and just ask away any questions you may have, and then I'll answer them in the order that we have. Okay, so I think we do have one question here by Captain Bernard Heights. Okay, so what do you recommend for chaplains to know about behavioral health? Well, I mean, that's everything, right? I mean, there's so many things to know about behavioral health, that I'm gonna have a hard time answering this question. But I would say, just in general, just the main things, right? Depression is very common. Anxiety is also very common. I think especially for chaplains that are in the military, like yourself, Bernard. I think PTSD, like trauma, is very common as well, something that you will encounter. And also, when I was in the military, what I saw often is what we call the adjustment disorder with depressed mood and anxiety. So what that basically means is that the soldiers are having a very hard time adjusting to the environment of the military, or whatever that may be. Maybe they just recently got separated or divorced or something like that. And so they're now having a really hard time. So that's a very common thing. But one thing to be careful is not to just say, oh well, it's all the environment or all the situational stuff that's causing the depressive symptoms. You do want to do your due diligence and make sure that they get seen by a mental health clinician, to just make sure and to rule out whether there is really an underlying clinical depression, in addition to maybe, or that is showing up as an adjustment disorder, like just looking like they just can't adjust to the new military environment. So yeah, I would say that's something to consider. And Bernard asked another question, which is, what are the top 6 behavioral health diseases that we should be aware of with patients? Oh, okay. So yeah, I think I already answered the question. So yeah, definitely depression, anxiety, PTSD, even OCD. And I would say also ADHD is actually pretty common as well, and something that I've seen when I was in the military. And not very common, but I mean, psychosis, what we call like a thought disorder, is there, but it's actually not common. And but another one that I just thought of is very common, I think, in the military population with young women, men and women, is substance use, right? And so substance use is very common in the military population, and not just in the military population, but I think in our whole society right now in general. Since marijuana being legalized in many states, I think that is actually doing a great harm in our population. Actually, most recently, there was a study that showed the causality correlation between smoking marijuana and schizophrenia and outbreak of schizophrenia in a young population. So substance use is definitely another condition that you should pay attention to. Another question. All right, let's go, Bernard. All right, you keep bringing it on. All right, is it best to go to the local hospital or go directly to a private practice for someone that needs a psychologist? I guess it really depends. I mean, because I think for most people, what what really determines where they get to be seen is whether they have coverage for for like insurance, right? So if they, like, for example, for the military population, obviously for active duty you have to be seen on the base, right? And even for the dependents, if they have TRICARE, then they're going to want to go to a place where they take TRICARE, whether it's on military base or even off military base. So I think that usually dictates where people get to be seen. And really, you can really go anywhere, I think, besides that financial preference. And as long as you find somebody who's qualified, I think where you go is not necessarily the most important question to ask. Is whether are you going to seek help. Really great questions. Thank you, Bernard, for asking those questions. All right. Let's see. Anything else? Yeah, I think given that today's Good Friday, a lot of people are probably not on Facebook, which I think is good. And so, yeah, what we're gonna do is, let's see. Um, are there any diagnostic frameworks to detect schizophrenia, bipolar, or depression to decide? Oh yeah, absolutely. I think so. You're asking, like, how do we basically diagnose these conditions? And so most well known, the framework is the DSM-5, right? They recently came out with the most updated version of that. But yeah, so that's what we would use to diagnose for these mental illnesses. All right. I think we will end it here. So thank you guys so much for joining me again today. I'm trying to do this every Friday, and so not necessarily same time. I'm given my own schedule, and I'm trying to fit it in somewhere on Friday. But most often on a on Friday noon ish. So like 12:30 Eastern and then 11:30 Central. So yeah, absolutely, Bernard. Thanks for joining me today, even though today's Good Friday, and hope you have a good day. All right, bye now.